So my first impression of Ron was after Nick was born. Nick was in the NICU, and we were just with him in a room talking to him about what it means that Nick was born with a rare genetic condition and was not healthy. And my impression was that he was just very caring.
I always knew that whatever part of medicine that I would pursue would involve children. You know, at one point I thought about becoming a cardiac surgeon, specifically for kids. Eventually I chose to specialize in both cardiology and genetics, and really sort of focus on heart problems that have a genetic origin that affect children. And all my work with children involve families, and I think that's the part of medicine that really I find gratifying, is not only the children, but the other parts of the family that are so essential to the health of the child.
Hearing Ron describe what he thought our son Nick had at birth, and slowly unfolding this information allowed us to realize that there was a shorter life expectancy than we could have imagined, and that also a flourishing life was possible for our son amidst that. Ron would be with us the entire time, and that we were in one of the world's best centers for knowledge and treatment about that condition. And somehow Ron would wrap all of that together into a very gentle disposition that made it feel like you could handle it, that it would be okay. And that's an incredible gift.
Because the patients that came to my clinic, many of them had connective tissue conditions, the connection to the Marfan Foundation came easily. The foundation and I worked together to try to provide answers. I think that as a team, we've done a lot of research to sort of improve treatment and outcomes for people with Marfan syndrome and related conditions. The biggest part of my collaborative research efforts with the foundation involve the multi-center pediatric heart network Marfan trial that we did between 2007 and 2014. Looking ahead, where should the foundation be in 20 years? There are successes, definitely. You know, I mean, surgical technique is better, medical therapy is better, making diagnoses are better. But it's unfortunately frequent enough that we're reminded that there are still shortfalls, that there are still people who have not been diagnosed. And there are still people who don't understand their condition. There are still people who don't have access to a specialized Marfan center like at Boston Children's. I think we need to spread the word. In 20 years, I hope that everyone knows what Marfan syndrome is. I hope that we have diagnostic capabilities so that everyone who has any of these genetic conditions that affect the aorta and connective tissue, that we can identify them early. Even though the medicines that we have are effective, I think people are still being treated and still need surgery and still have dissections, and so there's room for improved knowledge. In short, I think the foundation just needs to continue the work that they've done, and hopefully we can convince others to help us in that work. The government, the healthcare system, to sort of help overcome some of the barriers that we have faced over the last 20 years.